Fentanyl is killing people on our streets right now.
It was an opioid epidemic that has now become a fentanyl crisis.
The proliferation of drug abuse in the last 2 years must be halted.
People that continue in this cycle of addiction, that continue down this path, likely are not going to live very long.
And now I'm not going to allow this to continue to happen on my watch.
It's tough to see how fentanyl, how methamphetamine as well, have taken over our community in so many negative ways.
And as we think about how do we save lives, how do we help people, what do we as a sheriff's department do in the mayor's vision of this public health response to say we're in as well?
Sometimes we can see like, how are we ever going to make any sort of dent in this problem? But when I saw a program like we saw in Kenton County, it really gave me hope. It gave me hope that if we can mirror that out here and do something even better out here, that we can make a difference in our community, we can save lives, and we can really impact this fentanyl crisis that we're dealing with.
The Kenton County Detention Center has a phenomenal program. I've been to jails from border to border and coast to coast, and I've never seen a program of this scale that was run as well as it was. And in talking to the people in custody, they absolutely have hope that they will continue on that treatment program. And we've been a treatment center. In fact, the Denver Sheriff's Department and our jails are the largest mental health centers in the city and county of Denver, period. Second in the state, only second to the Colorado Department of Corrections, which is the largest mental health treatment provider in the state of Colorado. So we've already been doing this work.
The sheriff, his staff, Dr. Johnson, they've been talking about this for some time. How do we centralize those in our care and medically assisted treatment into a certain pod, into a male pod and a female pod, females that are in recovery and males in recovery. So that planning is going on, and seeing it, seeing how it was, and then seeing the success, it really motivates us to get this built up.
So for us, it's about ensuring that people understand that jail is not a place of punishment. The deprivation of someone's freedom is their punishment. Jails are places where we have to think about what happens after that person is released.
They had a 70-person male pod of inmates that were all engaged in treatment, and we got to visit that pod. To have 70 people all engaged in it, it also helps centralize the resources, centralizing the programming, and centralizing the medically assistance that they do. A big part of their program is about personal accountability and about them holding each other accountable. We got to sit during one of their treatment sessions and got to hear them holding each other accountable. And a lot of them shared with us that was a very important aspect of it, that each of them are holding each other accountable to their recovery.
I think they have a significant community response and support system that's different than perhaps we have today. I know we're working towards that, but in Kentucky, they have centers in their community where folks are given a warm handoff to those community providers that can help them to stay on those Medicated-Assisted Treatment programs and to also get that community support as well. That's something that we as a city, as a metro area, have to do better, because we have to meet people where the need is. Currently, what we do is when folks are in Medicated-Assisted Treatment, they go to Denver Health after they leave our custody on 6th and Bannock. And in talking to Denver Health, only 10% of the people that leave our custody are making it over there. And so we've got to rethink, how do we get far more people that are on our Medicated-Assisted Treatment programs into treatment?
Let me be clear. We're going to remain focused on addressing these problems until they're solved. And here's where we need our community's help. Be engaged. We can work together on this, and it's going to take the community to be engaged for us to make significant impact on the challenges that we are seeing.